thank you for inviting me. I'm Rob Marsh. I'm Head of Live Services at what is now NHS England. A few months ago, I was Head of Live Services for NHS Digital, but I'm sure most people will be aware of the merger that's taking place at the moment. So I'm going to talk about the pandemic, the pressures that we had, and ultimately how we've evolved from what was national service management into live services of today, and really how we've pushed the limits of our agile working. And we'll do a bit of a focus on the NHS app and COVID Pass. So I thought it'd be useful just to give you a bit of a visual representation of that journey. And back in around 2017, we had a service and operations an agile project. And basically that project looked at taking our horizontal approach, if you like, of teams. So we had teams that were focused on incidents, teams that were focused on problems, and providing cells that were much more focused on building relationships with our DevOps teams, working with programs, still covering all the normal ITIL processes, but a much more focused approach on the service. Then around 2019, we had the NHS app. Somebody else wrote the words plodding along. I'm not sure I'd quite go for that, but that was forecast to have about 1 million users by the end of 2021, and we've blown that out of the water now with the pandemic. What it did look at, though, it meant that we had a dedicated team looking at our process design and starting to build those relationships with our DevOps colleagues. Then the pandemic hit, and because the exposure of the NHS app to citizens, it was front and centre for providing COVID information, advice and guidance. And then back in, was it March 21, somebody came up with the idea of the COVID Pass, which would sit on the app as well as being able to get a paper copy. And that looked at changing the team's approach from a service management offering to a SIAM approach, as we looked at different suppliers being involved in that. Post-pandemic, and Secretary of State has said that the app's one of the way forwards. So we have a mobile first policy, and Wayfinder, which I'll talk about later, was very much the first, if you like, of many projects where we were using the NHS as platforms. And ultimately what we're moving to with NHS app, NHS login, is that SIAM model for our future. So I'll move on to the next slide. So I thought it would be useful for us just to talk about what we looked like post-pandemic and what we look like now. So as I mentioned, following the SOAP project, we moved to a cell-based approach, and that was an agile approach with DevOps. We've probably changed that now a little bit more, because before the pandemic, we were very much engaged with programs. Now as an organisation, we are product centred. So we speak more now about being product aligned. We're still very much aligned to ITIL. We still have those teams that are that align with our products, but we've dropped the cell reference now. Those teams have their own identity. We had an identity crisis, I think, where people kept referring to them as Cell 1, which didn't help the wider organisation because that didn't mean anything to them. So we had very much a focus on providing a bit more identity to those teams. We still talk about Agile, but now we change it to much more to our IT service ownership. And we've still got our processes, but we refer to it more now as in terms of proportional governance. And the whole move from these terms is more to present a one team approach rather than us sort of saying this is how we want to work and we will work with you to do this. It's more of us being there from the outset as one team, and you'll see later on in it we're trying to drop terms like early engagement for joint engagement for us going forward. And I think ITSM has always suffered a little bit within our organisation. It's something happening on the screen because I can see drawing appearing over my screen.
It looks like someone's turned on annotation, and I'm not quite sure how. Let me, Mark, do you have any ideas how we can stop that?
It's all right. I didn't know whether it was somebody sending me a message.
Oh, good, no problem.
So I think ITSM has always been seen as slowing DevOps down or being a blocker. And what we've been very much pushing in terms of being aligned to product and that one team approach is actually sort of saying that DevOps and ITSM, if they work together, can provide a better customer experience for us going forward. So I'll move on to the next slide. So when the pandemic hit, I broke it down into 4 main things that was pressures for our team. The first was we were expected to deliver new services, put pressure on our existing services as we supported the NHS in the difficult times. And this was a huge increase on what we'd been used to. And we didn't have the capacity just to be able to absorb new services, increase the rollout of our new services. So we ended up with using a lot of contingent labour. We ended up with dynamic resourcing. One of the things was that we wanted to make sure that as we introduce new services and we put that focus on those new services, that we actually had all the learning that we'd done, all the best practices in there. So a lot of the time you saw teams being split in 2, with contingent labour being added to both teams to allow those best practices, those ways of working to still come through. Another pressure that we saw was the culture, and that was we asked a huge amount of our staff while the pandemic was on. I think the whole of the NHS was asked to make huge sacrifices, and we had people working weekends, working over evenings, all at a time when we were telling them you need to work from home as well. And I think that's, while it broke down some of the barriers, I have teams that are in multiple locations spread across the country, and working with Microsoft Teams, all that went away. What we did see was teams became very isolated in how they were working. A lot of people's diaries got taken up by Microsoft Teams, calendar invites. It just meant that a lot of those normal conversations that you'd have in the office, just getting a coffee, as we termed it, the water cooler conversations, just weren't happening. So a lot of the time we ended up having our leaders introduce lunch and learns, coffee mornings, just so people could have those conversations. It was very much a talk about whatever you wanted. And post-pandemic, we're now seeing a push to the hybrid way of working, where we have now got teams coming into the offices, but teams again being siloed. So what we're trying to introduce is almost a social aspect, if you like, to teams' way of working. And we've been using a phrase for our leaders that they are social entrepreneurs at work, working out ways that they can link their teams together, making sure that their teams come into work on the same days, providing that well-rounded and fun place for people to work. And that's starting to mean that we have another shift in culture. And I think at the beginning we approached that as we've got to reset our culture. I'm not quite sure it is a culture reset. I think this is the next stage from how we are working going forward. What else did we do? So we had our objectives. So traditionally in the NHS, what was NHS Digital followed a 5-year plan, and that was set out. So you had broad guidelines, you know, what was needed to be delivered, and working with senior responsible officers, you generally had a business plan that covered 2 to 5 years on how you were going to deliver those objectives. In the pandemic, all that changed. It was literally the CEO saying, there's a fire over there, run in that direction. Can you, and then it could change the next day. You could be on it for 2 weeks, you could be on it for several months. What we also saw was a huge increase in our political landscape and the effect that it had on our delivery. And one of the things that we had was in the COVID pass element was, I can remember being on a senior management call and sort of saying, we're not sure what Boris is going to announce tonight. We know he's going to announce some things. We just need to be ready. That was unprecedented in how we'd worked before. So we ended up with a very much more firefighting and reactive mode to make sure our systems were stable and able to cope with spikes in demand. But underpinning all that was our agile and product alignment approach to how we deliver services within what was NHS Digital and now NHS England. So, as I mentioned, NHS app and the COVID response. The NHS app was front and centre due to its citizen-focused nature. We provided advice and guidance, signposting, repeat prescriptions, ways to help and protect the front line. And then we introduced COVID Pass. So COVID Pass was officially thought up around April. I think a month beforehand, I'd been told, get ready, in 2 weeks, you'll be on a new project. We have NHS X that's reached out to a third party to produce a COVID pass or COVID passport, I think it was referred to at the time. We built on the relationships that we'd had with our product team, so the NHS app, NHS login, to basically provide that service. It made a move to a SIAM approach. We now had a company called Netcompany that produced the business rules and the application that sits on the NHS app for the COVID pass. But our role within live services was to provide that end-to-end support. And what we saw was a huge increase in the usage of the NHS app. I think we predicted when it first started that we'd have around 1 million users by 2021. We blew that out of the water. We now have around over 30 million users. I think it's around 32 million users. We went from a team of 5 within live services to a team of 28 supporting that. And what I would have predicted a piece of work that we would have normally estimated a delivery time of around 8 to 12 months was delivered in around 10 weeks. And on the 17th of May, COVID Pass was available on the NHS app. It was a huge increase to the amount of traffic that we saw. So not only was we looking at it from COVID pass, but the existing services that sat on NHS app saw a huge increase in demand. It wasn't without its issues. We did see a number of major incidents. I'll caveat that we refer to them as high severity incidents, because major incidents in healthcare mean something slightly differently, but our services going down. A lot of that, though, I think, was us moving at pace, and just an unprecedented number of users that came on board to the system. But those issues were all dealt with within SLAs, and it's something that I think we were very proud of as an NHS Digital, being able to support the delivery of COVID Pass. So post-pandemic, what does it mean for the app? Well, Secretary of State, NHS app is still front and centre. We have a new policy called Mobile First Policy that enables access to NHS digital services. We are looking to, wherever we can, improve health outcomes and remove the burden on the NHS with as much help as we can provide. And NHS app is just a platform for us to do that. We have ministerial commitments that we are looking to achieve. They are also at aggressive timescales, but it does present as an opportunity. We're looking the NHS app now as an unprecedented number of users, and if we can provide any help to the NHS going forward, it will be worthwhile all the pain and aggro that we go through. So as well as what we've done with our COVID services, we're also looking at notifications and messages, online consultation, to allow citizens to be part of research, and I'll talk a little bit more in the next slides on one of our first big pieces of work, which is the Wayfinder project. We're building on what we put together in terms of our agile service management. We are looking at our ways of working. We constantly review that. We have a risk-based assessment approach to doing this. We understand that our traditional ITSM processes don't always lend themselves to be as efficient as possible, but with our project alignments, we are starting to see that joint approach to being able to provide these digital services. So the first example post-pandemic is the Wayfinder project, and that's really around our bookings and referrals. It's a fast-paced delivery. I think when we first got it, they were looking to do it in 3 months. It did get extended, but we've always had primary care appointments in the app. This goes beyond that, where we get patient engagement portals that provide appointment details and referrals for trusts. We have a third-party integrator that pulls all that information together so we can present it in the app. And what we've done is we've recognized that going forward within the app, we have a much more of a need for a SIAM approach. We have multiple vendors. Not all of them are contracted to us. Some of them are contracted to us. Some of them have contracts with the wider NHS. So our challenge now is, how do we maintain that same level of service as we go forward, when we have a mixed economy of suppliers and how we engage with them? So I'd just like to pull out a couple of things that we've realised as we move forward. And I think our integration and our governance have been something that we have been able to flex easily. We have worked very closely, built up very good relationships with our product teams, and we both have very much a customer focus. What we have done as we've moved through our agile ways of working is we've gone with joint engagement rather than early engagement. We have a team, our service design and transition team, and you would, as a normal program or product, you would raise a new work request to say we're doing this new piece of work. That would go into the system, the cogs would start turning, and we would have that engagement. Now, at that stage, I think it's too late for us to start building those relationships. So what we do now is our teams that work with those products help write that new work request. They are already involved before that new work request comes through. The new work request allows us as an organisation to see what's going live when. It forms part of our change management process and our assurance process. But actually, we are one team that approaches this. And that is something that we are keen that all our services move to as we go forward. And I think the NHS app, NHS login have been at the forefront of how we will take our service management and live services forward. I'm a little bit early, but I did leave time for questions if there was anything that people wanted me to cover. Otherwise, I can carry on talking about what we want to do going forward.